Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician, and today I want to talk to you about, how do you treat a pinched nerve? Now, a pinched nerve is where you have compression of the nerve at the spine. Okay, that causes pain throughout the nerve. It can cause numbness. It can cause tingling. It can make your muscles weak. Most commonly, we see this happen in the lower back, and what it does is it creates these symptoms and what's oftentimes referred to as sciatica. And sciatica is just basically the largest nerve that leaves the lower back and runs into the leg. If it gets pinched, it hurts, and we call it sciatica. And that's a inflammation of the nerve, and it can be very uncomfortable and create a lot of problems. And if left untreated, it can actually cause permanent damage to the nerve and the muscles that nerve supplies. So it's really important if you have a pinched nerve that you do get it evaluated so that the proper type of treatment can be recommended to you so that you can get out of pain, get your function back and avoid permanent problems. So let me show you, I'm going to show you on a model what the nerves look like in the spine and how they can become pinched or compressed. Okay, so this model shows you two bones of the spine. These are called vertebrae. Between it, there's a spinal disc. And if we look at it from the side, so this would be the front, turn to the side, here's the front, here's the back. The nerves exit at these big holes. See the hole there? So they come out between the hole. If this disc is injured, if it tears, if it bulges, which kind of gives way a bit, it can cause compression. If it ruptures and the material inside the disc, let's look at it from the top, this material comes out, it can cause very serious compression of the nerves, but also of this thing, which is the spinal cord. Not good. So let me show you what that might look like. This is the same model. It's just slightly more degenerated. This would be a spine that has some arthritis, some loss of the disc is breaking down, and this is a degenerative disc disease. You'll see here on the side, notice we don't have that large hole. Notice that there's this material that has come out of the disc. If we look at the disc from the top, you can see that the material which we had in our other disc here, see that, has torn through the tough outer wall of the disc and has come out and is compressing the nerve. Now this is a disc herniation, and this would be considered an extrusion, and it never really looks just like this, but you get the idea. It causes compression of the nerve and creates major problems for your function, and can lead to some really serious consequences. So listen, if you have a pinched nerve, some of the things that you need to do to treat it can be very gentle. It just depends on if you're a candidate for the treatments that we offer. They can be very beneficial. Some people are not candidates for what we do, and if you're not, then I'll help you get to the proper medical specialist for further workup and evaluation. But some of the therapies that we use are things like non-surgical spinal decompression therapy. We use super pulsed laser therapy, which is a cold laser. It's non-thermal. It will not burn you. And we use things like the active therapeutic movements too, which helps to improve pain with movement. It decreases your pain so that you can move through a fuller range of motion without hurting. Those are the most common therapies that we're going to use when there's a disc herniation. Our decompression therapy is a non-surgical form of treatment. It's very effective. It's gentle. It does not hurt, and it's very effective at helping to reduce and improve pain that's originating from disc herniations. What we do is, let's say this is your spine. We lay you on your back. Remember, this is the back side of the spine. This is the front, and we place you on a specialized table that's connected to a computer-driven motor. And what we do is we place a harness around your waist, and we program the computer to very gently pull. That pulling creates a very gentle pull, and it creates some separation of the disc. Now you can see there's slight movement here, right? Slight movement, and it takes pressure off the disc and helps to decrease the pressure in the disc and suck that material that can be herniating out back towards the center of the disc. That also helps to pull in water and other nutrients into the disc to help it heal. So it can help to decrease pain, improve your function, and improve healing of the injury. That's one of the things we use. The laser therapy that we use helps to decrease pain, decrease inflammation, and improve circulation. It can be very, very beneficial at helping you to recover and improve from a disc herniation. And then on top of that, the active therapeutic movements 2, the ATM2 for short, is an amazing piece of equipment that helps to improve muscle coordination and decrease pain with movement, which is oftentimes very, very difficult to do when you have a disc herniation. A lot of times if it's really significantly painful, you're splinting, you're locked up, you're maybe even bent forward. So just some of the things to consider that we may be able to help you with a pinched nerve. But if you have any questions, if you'd like my opinion on your case, I'd be happy to take a look at you. Just give us a call at 828-324-0800. My staff will be happy to help you out. Otherwise, you can visit us online at hickoryspine.com to learn a little bit more about our practice and what we do. But I hope this has helped you out today, and I hope you have a wonderful, wonderful day. Thanks.